Routine antenatal care. Hi there, starting on your pregnancy journey with us? We aim to make this journey safe and joyous. This video aims to give a broad overview of pregnancy care and what to expect during these 9 months. This will include the frequency and purposes of antenatal visits, investigations that will be performed, vaccinations offered, as well as the screening tests available. This video covers the process of antenatal care till delivery, and the information applies to low-risk pregnancies. If your pregnancy is deemed to be of higher risk due to pre-existing or newly diagnosed medical conditions, you may need to attend the clinic more frequently, and the care plan will vary accordingly. The aim of regular antenatal care is a safe pregnancy and delivery for both you and your baby. This is achieved through the early identification of risk factors and treatment of potential complications which may arise during the course of the pregnancy. It is therefore important to attend your antenatal visits as much as possible. During your first antenatal visit, the doctor will ask you several questions which are important in identifying factors which might increase your risk during pregnancy. This allows early intervention and referral to the appropriate services if necessary. Here are some examples of questions that you might be asked during the consult. Please volunteer relevant information about any medical, genetic conditions that you or your family members may have. After the doctor has taken a history from you, he or she will proceed to examine you. The following measurements will be performed: height and weight, blood pressure, listening to your heart and lungs, abdominal examination, and pelvic examination if appropriate. Your doctor will then perform a bedside ultrasound to confirm that the pregnancy has implanted in the right location, assess the number of pregnancy sacs, as well as check whether the baby's heartbeat can be seen. This ultrasound scan may be performed via the abdomen or vaginally, depending on the number of weeks of pregnancy you are currently at. An ultrasound scan in the first 3 months is the most accurate way of determining your estimated date of delivery, or your EDD. Occasionally, the EDD obtained from the ultrasound scan will differ from the EDD calculated by your last menstrual period by more than 5 days. In this situation, the EDD obtained by ultrasound will be used. If you're carrying twins, it is particularly important to have a scan in first trimester to check the chorionicity or the type of twin pregnancy which you might be carrying, whether it is a monochorionic or dichorionic pregnancy. All pregnant women are advised to take folic acid supplements until 12 completed weeks of pregnancy. This reduces the risk of your baby having a neural tube defect, which is an abnormality in the development of your baby's brain, spine or spinal cord. The minimum recommended dose of folic acid is 400 micrograms per day. Women who smoke are advised to stop once they're pregnant, as this can result in adverse outcomes for their baby, such as preterm birth, low birth weight, and stillbirth. Women are also advised to refrain from taking recreational drugs and alcohol during pregnancy. It is good to keep active during pregnancy, but contact sports, high-impact sports, and vigorous racket sports should be avoided. Walking, yoga, Pilates, and swimming are considered safe in pregnancy. Scuba diving, which may result in fetal birth defects and fetal decompression disease, should also be avoided. During pregnancy, women are advised to eat food that is freshly prepared and maintain a well-balanced, nutritious diet. Additionally, to reduce the risk of food-acquired infections, it is advisable to adhere to good food hygiene. To reduce the risk of infections such as listeriosis, salmonella, and toxoplasmosis, which are infections that are associated with adverse pregnancy outcomes, pregnant women are advised to do the following. To reduce risk of listeriosis, drink only pasteurized milk. Avoid eating ripened soft cheese such as camembert, brie, and blue-veined cheese. Avoid eating pâté. Avoid uncooked or undercooked ready-prepared meals. To reduce the risk of salmonella infection, avoid raw or partially cooked eggs or food that may contain them, such as mayonnaise. Avoid raw or partially cooked meat, especially poultry. To reduce the risk of toxoplasmosis infection, wash hands before handling food. Thoroughly wash all fruit and vegetables, including ready-prepared salads, before eating. Thoroughly cook raw meats and ready-prepared chilled meals. Wear gloves and thoroughly wash hands after handling soil and gardening. Avoid the handling of cat feces in cat litter or in soil. Few medicines have been established as safe to use in pregnancy. Paracetamol or Panadol is considered safe and may be taken in case of fever and headache. Both prescription and over-the-counter medicines should be used as little as possible during pregnancy and only when the benefit outweighs the risk to the pregnancy. There are some common symptoms which women may experience during pregnancy. Nausea and vomiting occurs in 75 to 85% of pregnancies. It usually resolves spontaneously by 16 to 20 weeks of pregnancy and is usually not associated with a poor pregnancy outcome. If necessary, your doctor can prescribe medications to help with vomiting in pregnancy, which are safe for you and the baby. Heartburn or acid reflux is another common symptom which women may face. This is mostly relieved by diet modification and avoiding lying down immediately after eating. Medications such as antacids can be taken if symptoms persist. Constipation is common in pregnancy and is usually improved by diet modification, including fiber in diet, staying active, and drinking 5 to 7 glasses of water daily. Stool softeners such as lactulose can be taken in pregnancy if needed. Pregnant women often experience backache due to the weight of the growing womb and their posture. This is often relieved by rest, simple stretching, and simple analgesia such as paracetamol. All pregnant mothers are encouraged to obtain the flu vaccination. This can be taken at any stage of pregnancy and will generally be offered around 26 weeks. Catching the flu, particularly in the later stages of pregnancy, increases the risk of serious complications for the mother, such as pneumonia. Women with the flu are also at increased risk of miscarriage, premature birth, and stillbirth. Additionally, obtaining the flu vaccine in pregnancy provides your baby with immunity to the flu during the first few months of life. Early in pregnancy, you will be asked to take a blood test to screen for anemia, thalassemia, blood group, and infectious diseases such as hepatitis B, HIV, syphilis, and rubella. If you're known to have a rhesus-negative blood group, it is important to highlight this to your doctor, as this may have implications on your current and future pregnancies. Screening your baby for Down syndrome and other chromosomal abnormalities is optional and not compulsory. Your doctor will go through with you the current tests that are available for screening your baby for Down syndrome and 2 other rarer genetic conditions called Edward and Puthow syndrome. The screening options available include the combined first trimester screen, which is performed between 11 to 14 weeks of pregnancy, or non-invasive prenatal screening, which is performed after 10 weeks. Pause here if you're considering Down syndrome screening. A detailed ultrasound will be performed for your baby between 20 to 22 weeks of gestation. This ultrasound is aimed at detecting major structural defects in the fetus, but will not pick up all abnormalities. If any structural anomalies are identified, then you will see a maternal fetal medicine specialist, and further counseling and testing will be offered to you. Another purpose of this scan is to measure the blood flow through the vessels which supply the uterus, known as the uterine arteries. This is to determine if you are at an increased risk of intrauterine growth restriction, a condition where your baby does not grow as well as expected, as well as preeclampsia, which is a condition that can develop after 20 weeks of gestation. If you're found to be at an increased risk of developing these conditions, your doctor may commence you on low-dose aspirin until 36 weeks. The frequency of your antenatal visits will depend on whether your pregnancy is deemed low or high risk. If your pregnancy is progressing smoothly and you're in good health, you may not be seen as often as someone who needs to be monitored more closely. In general, you will be seen in the clinic every 4 weeks until 32 weeks, then every 2 weeks until 36 weeks. Clinic visits will then be once a week until delivery. During your antenatal visits, the following will be performed: urine test, blood pressure, and weight measurement. Fetal growth by measuring symphyseal fundal height, abdominal examination to check the fetal lie and presentation, and also listening to the fetal heart. Preeclampsia is a potentially life-threatening condition to both mother and baby, which can develop after 20 weeks of pregnancy. It is characterized by raised blood pressure and the detection of protein in the urine. Blood pressure measurements and a urine test will be performed at every visit to screen for the development of this condition. Certain women are at increased risk of developing preeclampsia. If you're found to have one or more of the following risk factors, your doctor may start you on low-dose aspirin from 12 to 36 weeks to reduce the risk of preeclampsia in pregnancy. It is important to note that the symptoms of preeclampsia can develop at any point during the pregnancy. If you develop any of the following symptoms after 20 weeks of pregnancy, please seek immediate medical attention. All women will be asked to take an oral glucose tolerance test between 24 to 28 weeks of pregnancy to screen for gestational diabetes, which occurs in up to 15% of Southeast Asian women. To take this test, you will be asked to avoid consumption of food or beverage besides water, as well as avoid smoking or strenuous exercise for at least 8 hours overnight. Blood will be drawn from you at 3 different time points, each 1 hour apart. After your first blood draw, you will be asked to drink a sweetened beverage within 5 minutes. The next 2 blood tests will be taken 1 and 2 hours after you have consumed the beverage. Women who are at an increased risk of having diabetes even before they have become pregnant might be asked to perform this test in the first trimester. Women who have had a normal result on the first trimester glucose test will be asked to repeat it at 24 to 28 weeks. Screening for gestational diabetes is important, as undetected GDM in pregnancy is associated with an increased risk of having a large baby, and this may result in your baby getting injured during the delivery process. There is also an increased risk of your baby requiring admission to neonatal ICU due to jaundice, respiratory distress syndrome, and hypoglycemia. In Singapore, a scan in the 3rd trimester is routinely performed to assess your baby's growth. During this scan, an estimation of your baby's weight will be performed by ultrasound. This scan will also assess the fluid level around the baby, the blood flow in the umbilical cord, as well as the position of the placenta and your baby. If your baby is growing within the expected ranges, there will usually be no further scans until your delivery. If your baby is growing smaller than expected, you may require serial growth scans to monitor your baby closely. As you approach 36 weeks, your doctor will have a discussion with you about your birthing preferences and mode of delivery. The options for pain relief during labor, as well as the signs and symptoms of labor, will also be discussed during this consult. All pregnant women will be offered screening for a bacteria which is found in the genital tract of some women, known as Group B Streptococcus, or GBS in short. The screening for GBS is done by performing a gentle swab at the opening of the birth canal between 35 to 37 weeks. If GBS was found to be present in a previous urine test that you had performed during pregnancy, a GBS screening swab is not required. The presence of GBS in the birth canal has been associated with an increased risk of infections in the newborn following a vaginal delivery that can be life-threatening. This risk can be reduced by starting intravenous antibiotics during labor. Clinic visits will become more frequent as you approach your due date, and women are generally seen weekly from 36 weeks of gestation. Around your due date, an ultrasound assessment of the water level around your baby, as well as the blood flow in the umbilical cord, will be performed to ensure your baby is doing well. If these measurements are within the normal range, an induction of labor will be arranged between 41 to 42 weeks of gestation. This is because babies born after 42 weeks of gestation are more likely to require delivery by cesarean section and are at a slightly increased risk of a stillbirth. We hope that this video has helped in outlining your pregnancy journey with us. Please approach your doctor if you have any questions regarding your pregnancy care.